So good day everyone. Today I will be presenting the content of module number 4 in the subject PS1 The Child and Adolescent Learners and Learning Principles. So for module number 4 class, this will be the introduction. This section discusses three areas by which physical development can be understood. So chapter 4 focuses on the influence of genetic outcomes in the prenatal development. So as understood in the earlier discussion, development in several areas is interconnected and dependent with one another. So physical development, however, is crucial among other developments such as cognitive, social, and moral domains. So the following class are the objectives of this module. So at the end of the module, students should be able to 1. Determine the influence of genetic processes in the development of children. 2. Discuss the relevant concepts and processes concerning the beginning of life and stages of prenatal development. 3. Design a personal family tree focusing on one's characteristics and contrasting it with one of the parent siblings' characteristics. And 4. Analyze how genetics work by comparing what characteristics were inherited from a child's parents. So class, for the content and discussion of module number 4, it entails also the chapter 4 entitled Prenatal Development. So the beginning of development happens upon conception. That is the union of the egg and the sperm cell. So subsequent changes brought about by the developmental stage can be traced in this crucial period of life. So the prenatal stage is considered to be one of the shortest periods of development, beginning from the conception until birth, but can also be the most crucial of all the stages. So, prenatal development class is the process that occurs during the 40 weeks prior to the birth of the child. So, while you think of a child development as something that begins during infancy, the prenatal period is also considered an important part of the developmental process. So, prenatal development class is the time of remarkable change that helps set the stage for future psychological development. So, the brain develops over the course of the prenatal period, but it will continue to go through more changes during the early years of childhood. So the process of prenatal development occurs in three main stages. The first 2 weeks after conception are known as the germinal stage. The third through the 8th week is known as the embryonic period, and the time from the 9th week until birth is known as the fetal period. The beginning of life. So, ovulation. This is the signal of the readiness of a woman of becoming pregnant when a sperm cell has penetrated the ovulated egg cell. So, this means, class, that ovulation is when a mature egg is released from the ovary. The egg then moves down the fallopian tube where it can be fertilized. So, if the sperm are in the fallopian tube when the egg is released, there is a good chance that the egg will be fertilized. So, it will create an embryo which can grow into a baby. So, next is fertilization. So, the union of egg and sperm cells. So, this is the process of combining the male gamete or the sperm with the female gamete or the ovum. So, the product of fertilization is a cell called a zygote. Next one is zygote. So, this is called the new cells. Zygote is an egg that has been fertilized by sperm and which could develop into an embryo. So the prenatal stage typically covers 40 weeks to 280 days. So including the additional 2 weeks to account for the last menstrual period and ovulation. Hence, the average human gestation is from 37 to 4 weeks. Infants are born earlier than 37 weeks are considered preterm, while those that are born 42 weeks or more are called postterm. Both cases are threats to child survival, although recent developments in the use of technology and medical science has drastically increased the rate of survival. So, next one class is the genotype and then phenotype. So, when we say genotype, these are the genetic characteristics that are not observable. So, examples here are the color of your eyes, hair color, your height, and the shoe size. Next one is the phenotype. So these are the genetic characteristics that are observable. So one example here is your skin color. Okay, so next class will be the stages of prenatal development. So the development that occurs all throughout the prenatal are divided into three substages of development. So these are the germinal stage, which talks about the fertilization up to 2 weeks. Next will be the embryonic stage. This will cover 2 weeks up to 8 weeks. And the last stage will be the fetal stage. So it is from 8 weeks to birth. So these stages have distinct activities most especially in the physical development of the organism. So first one will be the germinal stage. So in approximately 3 to 4 days, the zygote travels along the fallopian tube and eventually implant itself to the uterus wall. So the mitosis or the cell division permits the development of blastocysts. Aside from the protective function it serves as at this stage. So it is also the source of the development of the amniotic sac, placenta, and the umbilical cord. So class, in the germinal stage, this begins at conception when the sperm and egg cell unite in one of the two fallopian tubes. So the fertilized egg is called a zygote just a few hours after the conception. The single-celled zygote begins making a journey down the fallopian tube to the uterus. So cell division begins approximately 24 to 36 hours after the conception. Through the process of mitosis, the zygote first divides into 2 cells, then into 4, then into 8, 16, and so on. So a significant number of zygotes never progressed past early part of the cell division. So with as many as half of all the zygotes surviving less than 2 weeks, once the 8th cell point has been reached, the cells begin to differentiate and take on certain characteristics that will determine the type of cells they will eventually become as the cells multiply. So they will also separate into two distinctive masses. The outer cells will eventually become placenta, while the inner cells form the embryo. Okay, class. So the next stage will be the embryonic stage. So the significant development in this stage is the formation of major organs that form the biological system, such as respiratory, digestive, and nervous systems. So before the end of the 8th week, limbs can be identified already that would appear like an underdeveloped fetus. This rapid development of organ is also accompanied by more risk of spontaneous abortion or yung tinatawag nating miscarriage. Most especially during the first trimester or yung first 3 months ng pregnancy. In the whole period of pregnancy, this is considered as the most crucial. It develops in an intrauterine cavity through the amniotic sac composing of the amniotic fluid. So this results to the development of the umbilical cord and the placenta, which supply the nutrients and other hormones that are necessary during pregnancy. So at this point, class, in the embryonic stage, the mass of cells is now known as an embryo. So the beginning of the third week after conception marks the start of the embryonic period. So a time when the mass of cells becomes distinct as a human. The embryonic stage plays an important role in the development of the brain. Approximately 4 weeks after conception, the neural tube forms. The tube will later develop into the central nervous system, including the spinal cord and the brain. The neural tube begins to form along with an area known as the neural plate. The earliest sign of development of the neural tube are the emergence of two ridges that form along each side of the neural plate. So over the next few days, more ridges form and fold inward until a hollow tube is formed. Once this tube is fully formed, cells begin to form near the center. The tube begins to close and brain vesicles form. These vesicles will eventually develop into parts of the brain, including um, including the structures of the forebrain, midbrain, and the hindbrain. So around the fourth week, the head begins to form, quickly followed by the eyes, nose, ears, and mouth. The blood vessels now that will become the heart start to pulse. During the fifth week, so buds that will form the arms and legs appear. By the eighth week of development, the embryo has all of the basic organs and parts except those of the sex organs. At this point, the embryo weighs just 1 gram and is about the inch in length. By the end of the embryonic period, the basic structures of the brain and central nervous system have been established at this point. So the basic structure of the peripheral nervous system is also defined in this stage. Next stage will be the fetal stage. So this is considered the longest and final stage of pregnancy, lasting until giving birth. So aside from having all organs to be highly developing, senses are becoming more functional, such as fetus being able to respond to the heartbeat and voice of the mother, while sense of olfaction develops at 14th week. So locomotion can be felt also by the mother, most especially when the fetus is stimulated. Fetus also manifests certain degree of memories, especially on the voice of the mother. So the fetal period of prenatal development class marks more important changes in the brain. This period of development begins during the ninth week and lasts until the birth. So this stage is marked by amazing change and growth. The early body systems and structures established in the embryonic stage continue to develop. So the neural tube develops into the brain and spinal cord, and neurons continue to form. Once these neurons have formed, they begin to migrate to their correct locations. Synapses, or the connections between neurons, also begin to develop. So between the 9th and 12th week of the gestation, reflexes begin to emerge. The fetus begin the fetus begins to make reflexive motions with its arms and legs during the third month of gestation. The sex organs begin to differentiate by the end of the month, so all parts of the body will be formed. At this point, the fetus weighs around 3 ounces. The fetus continues to grow in both weight and length. So although the majority of the physical growth occurs in the later stages of pregnancy, the end of the third month also marks the end of the first trimester of pregnancy. During the second trimester, or months 4 to 6, the heartbeat grows stronger and other body systems become further developed. Fingernails, hair, eyelashes, and two nails are also formed. Perhaps most noticeable, the fetus increases about 6 times in size. So next will be the factors affecting prenatal development. So recent researches suggest that certain factors play an important role in the development of a child during prenatal period. So these factors gives prime importance to the prenatal child care for a healthy and secure birth and describes a number of factors that can influence the prenatal development. The following discussion depicts common factors affecting the prenatal stage positively or negatively. So letter A, we have the threats to prenatal. So number one is miscarriage. So this happens when the baby is lost before the 20th week of gestation. So a miscarriage class is the spontaneous loss of a fetus before the 20th week of pregnancy. So pregnancy losses after the 20th week are called stillbirths. Miscarriage is a naturally occurring event unlike medical or surgical abortions. Miscarriage class, ito po yung mga nakunan. Iba naman yung sinasabing abortion. Kasi si abortion, nag-undergo siya ng medical or surgical na processes. Pero si miscarriage, ito yung talagang hindi inaasahan ni mother na mawawala yung kanyang baby. So, a miscarriage may also be called a spontaneous abortion. Other terms for the early loss of pregnancy include the following. So, kapag si miscarriage class can also be called a spontaneous abortion. So, there are different types of abortion. Number one is we have the complete abortion. All of the products or the tissue of conception leave the body. Next is incomplete abortion. So, only some of the products of conception leave the body. Next is inevitable abortion. So these are the symptoms cannot be stopped and miscarriage will happen. Next is infected abortion. The lining of the womb or the uterus and any remaining products of conception become infected. And the last is the missed abortion. The pregnancy is lost and the body products of conception do not leave the body. Okay, next we have the ectopic pregnancy. So while it is expected that the zygote will implant itself in the uterus, there could be instances where it is implanted along the fallopian tube or elsewhere outside the uterus. So an ectopic pregnancy most often occurs in a fallopian tube. So which carries eggs from the ovaries to the uterus. This type of ectopic pregnancy is called a tubal pregnancy. Sometimes an ectopic pregnancy occurs in other areas of the body, such as the ovary, abdominal cavity, or the lower part of the uterus, or yung cervix, which connects to the vagina. An ectopic pregnancy can't proceed normally. So the fertilized egg can't survive in the growing tissue, may cause life-threatening bleeding if left untreated. So there are some things that make you more likely to have an ectopic pregnancy. So these are number one, we have the previous ectopic pregnancy. If you had this type of pregnancy before, you are more likely to have another one. Next is the inflammation or infection. So sexually transmitted infections that can cause inflammation in the tubes and other nearby organs. So this may also cause ectopic pregnancy. Next is we have the fertility treatments. So some research suggests that women who have in vitro fertilization or yung IVF or similar treatments are more likely to have an ectopic pregnancy. Next is we have the tubal surgery. So this is the surgery to correct a closed or damaged fallopian tube. can increase the risk of an ectopic pregnancy also. Next is the choice of the birth control. So, the chance of being pregnant while using an intrauterine device or yung IUD is rare. However, if you do not get pregnant with an IUD in place, it's more likely to be ectopic. And the last will be the smoking. So, cigarette smoking just before you get pregnant can increase the risk of an ectopic pregnancy. So, the more you smoke, the greater the risk that upon getting pregnant class, you will be ending up having ectopic pregnancy. Kapag ka yung ang tawag na nito, we have vices like smoking. Next is number 3, complication associated to pregnancy. So, upon gestation, hormonal and biological changes are expected rapidly. This may cause medical-related complications that can cause loss of pregnancy. So, the following are some common maternal health conditions or problems a woman may experience during pregnancy. Number 1 dyan, class, is anemia. So, this is having lower than the normal number of healthy red blood cells. Next is UTI, urinary tract infections. So, a UTI is a bacterial infection in the urinary tract. Next is mental health conditions. Some women experience depression during or after pregnancy. So, marami po yan. It really causes complication to pregnancy, yung mental health condition ng isang buntis na babae. Next is hypertension. So, chronic, poorly controlled high blood pressure before and during pregnancy puts a pregnant woman and her baby at risk for problems. So, check your hypertension always or high blood pressure always if you are pregnant. Next is diabetes. So, learn about types of diabetes during pregnancy. The percentage of women affected. Managing diabetes can help women have healthy pregnancies and healthy babies. Next is obesity and weight gain. So, recent studies suggest that the heavier a woman is before she becomes pregnant, the greater her risk of pregnancy complications. So, we must do exercise kapag alam nating pregnant na tayo to avoid gaining weight. It's too much difficult kapag nag-gain ng weight before you before you deliver a baby or yung mga nganak na. Next is we have the infections or infections infected with HIV, pwedeng viral hepatitis, STDs, or TB. So, this may cause also complication to pregnancy. Next is the hyperemesis gravidarum. So, many women have some nausea or vomiting or morning sickness, particularly during the first 3 months of pregnancy. The cause of nausea and vomiting during pregnancy is believed to be rapidly rising blood levels of hormone called HCG, which is released by the placenta. Okay, next, we have number 4, yung last, bleeding or spotting. So, this is blood discharge while on gestation, most especially during the first trimester. So, bleeding and spotting from the vagina during pregnancy are common. If you bleed or spot during pregnancy, it doesn't always mean there's a problem. But in some cases, they may be signs of a problem. But in some cases then, they may be signs of a problem for you or your baby's health. If you have heavy bleeding, call your healthcare provided right away. Bleeding and spotting in pregnancy don't always mean there's a problem, but they can be a sign of miscarriage or other serious complications. So, what is the difference between bleeding and spotting? When we say bleeding or spotting, it can happen anytime. From the time you get pregnant to right before you give birth. So, spotting class is a light bleeding. It happens when you have a few drops of blood on your underwear. So, spotting also is so light that the blood wouldn't cover a panty liner. While bleeding naman is when the blood flow is heavier, enough that you need a panty liner or a pad to keep the blood from soaking our underwear and clothes. So what causes bleeding or spotting early in pregnancy? So it can be caused by the following factors that I will be um, discussing with you. Number one is yung having sex um, while in the process of pregnancy. Next is an infection, also can cause blooding or spotting. Next is implantation. We also have hormonal changes. And then yung changes in your cervix. Siyempre, it will change kasi you are developing a baby on your womb or in your uterus area. So your cervix probably will have changes. Next is your certain type of testing. And then last is problems related to smoking. If you smoke, it is best to stop before pregnancy or as soon as you know that you're pregnant, you stop smoking na fast. Or any vices na meron ng isang girl if she got pregnant. Every vices that she have must stop for the baby's sake and for her health also. Okay, so next will be the letter B. So these are the factors affecting pregnancy. So number one is the maternal context. The characteristics and the readiness of the mother's biological system can greatly affect the quality of development that will take place. So this is also refers to maternal health. Maternal context refers to the health of the woman during pregnancy. So childbirth and the postnatal period. Each stage should be positive experience, ensuring a woman and their babies reach their full potential for health and well-being. So every pregnancy and birth is unique, addressing inequalities that affect health outcomes, especially sexual and reproductive health and rights and gender, is fundamental to ensuring all women have access to respectful and high-quality maternity care. So next will be number 2, we have medical-related concern. The kinds of medication the mother has taken before and during pregnancy can possibly cause deformities, delayed development, and fatality. So every pregnancy has some risk of problems. You may have problems because of a health condition. So you had before you got pregnant. You could also develop a condition during pregnancy. So other causes of problems during pregnancy can include being pregnant with more than one baby. So a health problem in a previous pregnancy, drug use during pregnancy or yung intake of drug natin during pregnancy, or being over age 35. So this can affect the pregnancy of a woman, yung in tinitake nating mga gamot during the process of pregnancy, and also if you have a health problem previous or prior getting pregnant, it can also affect, and also our age. Over age 35 above is seems to um, likely encounter difficulty in getting pregnant kapag yung age natin is 35 above. There are some women or there are some women na nahihirapan um mahirapan magbuntis kapag medyo nasa middle adulthood na sila or late adulthood na sila. Next is any of this can affect your health. the health of your baby or both the mother and the baby. So if you have a chronic condition, you should talk to your healthcare provider about how to minimize your risk before you get pregnant. So once you are pregnant, you may need a healthcare team to monitor your pregnancy. So it is very important, class, that if you are pregnant, you should have your monthly check-ups, hindi lang once or hindi lang twice, hindi lang pag nalaman mong buntis ka, at yung time na manganganak ka na. We should undergo monthly check-ups for us to see if our baby's health is at risk or okay, or yung both na health ni mommy and baby is in a good condition. Next is the environmental factors. So the amount of social support provided by the immediate environment can affect the quality of pregnancy experienced by the mother. So studies have indicated that various societal factors such as toxicant exposure, maternal habits, occupational hazards, psychosocial factors, socioeconomic status, racial disparity, chronic stress and infection may impact or have a great impact in pregnancy outcomes. So this all can affect the pregnancy journey of a mother. So before it happens, mothers should seek remedies for preventing adverse pregnancy outcomes in the future. So if the mothers knows that um the environmental changes around her may affect yung pregnancy journey niya, mother should always see to it that the environmental factors in her pregnancy journey can always have a positive impact to her. Hindi yung hindi yung environmental factor that will be cause yung stress niya in pregnancy. Next, number 4, we have other factors. So, equally important is the quality of the sperm that comes from the father. So, the genetic makeup that is shared by the father may result to deteriorated physical and cognitive functioning to the child. So, this is called the paternal factors. So, father's exposure to lead, radiation, certain pesticides, and petrochemicals may cause abnormalities in sperm that will lead to miscarriage or disease such as childhood cancer. As in the case of older mothers, older fathers also may place their offspring at risk for certain defects. So in other factor class, it talks about yung sa paternal side. Any negative factors na na-encounter ni father will definitely affect the sperm that will lead to miscarriage kapag once na nandun na siya sa uterus ng isang babae. So it is not always in the side of the mother that can affect the pregnancy, but it is also have the certain factors na that will take in the paternal side or in the paternal factors na pwedeng maka-affect sa pregnancy ng isang mother. So anyone who has ever been pregnant can tell you the truth about pregnancy is that it is one of the strangest experiences that any woman can have. One that is filled with joy, frustration, fear, and love. For some women, the experience is relatively straightforward. So for others, it is confusing and challenging. So sometimes a woman experiences a pregnancy so strange and noteworthy that it goes down in the history. So other times they endure experiences but are completely normal. So class, that will be the end of our video recorded discussion. So thank you for listening. Have a great day ahead. So let me leave you with this quotation. Making decision to have child, it is momentous. It is to decide forever to have your heart go walking around outside your body. So this quotation comes from Miss Elizabeth Stone. So thank you again, class, for listening. Have a great day ahead.